Hello and welcome to another episode of HOC TV. Thank you all for tuning in today. I'm here with Mrs. Trina Manning. She works at Midland Memorial Hospital.
Hello.
And she's going to talk to us about fears of being in same-day surgery.
Hi, how are you doing?
I'm doing good, good.
A couple areas I want to talk about is a lot of people that do elect to have same-day surgeries. A lot of them, the two major fears I would say personally is fear of pain when you wake up and also fear of being nauseated and the rumors that you hear about anesthesia. A couple things that can help you and prevent that is just simple communication to your preoperative nurse. Even whenever you come ahead of time and they do a preoperative service for you through Midland Memorial, they will ask you questions. If anyone in your family has had issues in surgery, you want to be sure you give us that information as well, because it can or may have an effect on your surgery. The two areas I'm going to talk about is nausea. Everybody's afraid of the anesthesia and waking up and being sick to their stomach for whatever reason. And there's a lot of things that you can do beforehand. Is be sure you adhere to not eating before your meal as you're told. Okay, let them know, of course, if you have a history of nausea from previous surgeries or someone in your family, because it can, follow the lines of, like that. The other thing you can do is let your anesthesiologist know those fears before surgery, because what happens when you wake up from surgery, once the anesthesiologist has given you the preoperative medication, you usually don't remember, what we talked about up until you got that medication. So it's really important to get educated before surgery, even though a lot of the information is repeated at discharge. So we want to know that what your fears are in those two areas. Pain is another area we want to make sure that we go ahead and cover. We use different modes of communication. The main one is the pain scale. A lot of us have heard about 1 to 10. Before surgery, because when you first wake up, you're not really yourself. Your cognition might be a little impaired from the anesthesia. And so, the first thing the nurses will ask you when you wake up in recovery is, tell me about your pain. And we want to know a couple areas. Is it sharp? Is it dull? Consistent? Intermittent? Or is it, if you can't handle the pain, we give you the medications according to the doctors of anesthesiology, and we take care of that. That's the first phase of recovery. The same-day surgery, before you leave our area, we make sure that that pain is managed on that pain scale. And when you get up to back to the same-day services, then we'll also manage some more of your pain until you're ready to get up and go home. There's a criteria that you meet before you leave the post-op surgery, the same as there's a criteria that you meet before you even go back to surgery. So it's very important that you let us know about your fears and about how we can better serve and take care of those fears with that pain. Elective surgery is very common, but it is no longer anything you need to really be afraid of. It's better to be healthy and take care of things preventively.
Thank you, Ms. Trina. That is good information to have, especially if you're having same-day surgery and you have fears and you're wanting to know. This is great information to know. Thank you so much.
Thank you.
And thank all of you for tuning in to HOC TV.
Thank you.